Hi, my name is Dr. Stephen Stokes. I own Advanced Pain Solutions in Fort Myers, Florida. I want to talk about stomach problems. I have a personal story about this that I think is going to help a lot of people who are suffering. I frequently do experimentation on myself with alternative health, especially with supplements and vitamins, just to see how my body responds. And then if it works out well for me, I usually make those recommendations to patients. I rarely will make a recommendation to a patient that I myself haven't experimented with. So about a year ago, I was playing around with turmeric. Specifically, I was mega dosing turmeric. So I was taking about 10 grams of turmeric a day. And what happened was I irritated the lining of my stomach, and it produced a severe case of gastritis. Basically acid reflux. And it weakened the little valve that goes between my stomach and my esophagus to allow the acid to come up. So I was driving home one day from the office. I started to get a lot of pain in my chest. Severe pain in my chest, nothing like I've ever experienced before. It was so bad that I went to the urgent care center and did an EKG because I thought I was having a heart attack. It was that bad. I'd never had anything like this before in my life. So the next day I went to see Dr. Alan Tannenbaum, who's an MD. He's an internist. He's a friend of mine. He's also my personal physician. We talked about it, and he said, this is acid reflux. That's what it is. And I said, oh, okay. And he said, look, take some omeprazole, wrote a prescription, and he said, it'll just go away. So I followed the advice. I took the omeprazole, and within a few days, I had no more real problem there. It seemed like it cleared it right up. And he told me to keep taking the omeprazole, forever. I started to, maybe a week into taking the omeprazole, I started to develop other symptoms, side effects. I had trouble sleeping at night. I started developing anxiety, shortness of breath, ear hunger, all sorts of weird things started happening with the omeprazole, so I had to stop taking it. And then I stopped taking the omeprazole, and right away I got the acid reflux back. Now, omeprazole is an inhibitor, so what it does is it stops your stomach's natural production of acid. It completely stops it. So that can take care of the immediate problem, but long term there are other implications. Long term there's negative implications of taking omeprazole. And I was one of those people that didn't respond well to that. So I was back where I started. And I thought, what am I going to do? And first thing you do, of course, is you start looking on the internet, and I noticed everybody's talking about apple cider vinegar. So I thought, well, yeah, that makes sense. I'm going to take apple cider vinegar, and it's going to increase stomach acidity, because the problem is my stomach's really not making enough acid and all this nonsense. So I tried apple cider vinegar, and it made me 10 times as bad, 10 times worse. So that was not the answer, obviously. So I began to do more research, and I devised a 3-step plan to get better, which worked really, really well. And this is what's going to help you. First and foremost, if you're having these problems, you want to get a test for H. pylori. H. pylori is a bacteria that looks like a corkscrew, and it gets in your stomach and it corkscrews, it spirals its way into the lining of your stomach. And when it gets implanted in there, it starts to excrete an alkaline material. Actually, it's called an alkaline chemical, ammonia. And the ammonia neutralizes the acid in that area so that the bacteria can live. And then it just perpetuates, it breeds, and long term it can cause stomach cancer and all sorts of health problems. So you want to make sure, first of all, you don't have H. pylori bacteria, because if you do, you need to get rid of that. And you're going to have to take antibiotics for that. And that's a very difficult bacteria to kill. Some people that don't want to take antibiotics, there are herbs like garlic and wormwood and things like that that may work, but if you've got H. pylori, I recommend you take the antibiotics. Go see your primary, get antibiotics, kill the bacteria. So I did a breath test where you breathe in a bag and they test the air from your lungs, from your body, to see if it has certain chemicals in it that would indicate H. pylori. And I was negative, no H. pylori, which is great. Next thing that you have to do is, you don't have H. pylori, but you've got to heal the stomach before you can rebuild it. So that means low acid diet based on Jamie Kaufman. She's got a great book out called Low Acid Diet, I think it's called. Follow that. So you're eating alkaline foods. And you have to make sure that you don't overproduce acid, because the stomach is irritated. So even though the stomach normally produces acid, more acid or increased acid production is going to irritate the lining. That's why drinking vinegar is not a good idea at this point. So what I did was I took a couple of things: chlorophyll. I took about 9 chlorophyll complex a day. Chlorophyll soothes the stomach lining and helps rebuild it. And I also took a combination of herbs called High Pep. And it's going to have some licorice in there, a specific type of licorice that doesn't increase blood pressure. It's going to have chamomile and a couple of other things that is, again, designed to soothe the stomach lining. For me personally, I started taking that and I felt better immediately, but I was still having some problems. So I took Pepcid. Pepcid is different than omeprazole. Pepcid is not going to turn off the acid production completely in your stomach. It's just going to reduce it. So Pepcid was a great drug for me to take. It's over the counter. I took one in the morning. I think I took 10 milligrams. 10 milligrams in the morning, 10 milligrams in the evening. A very small amount, but it was just enough to cut the edge on my stomach to allow it to heal. So I took Pepcid twice a day, and I did chlorophyll complex and High Pep. And I did that for about 2 months. Took about 2 months of that to get my stomach lining to start to heal. After that 2-month period, I began to reintroduce foods into my diet, more acidic foods like red meat, and I stopped taking the Pepcid. Now, when I stopped taking the Pepcid, I had a little bit of a rebound that occurred, not too bad, about a week or so where my symptoms came back. But during that time, I began taking digestive enzymes. So for me, it was Zypan. So Zypan is a combination of acid and pepsin, and that's really important because you need the pepsin as well as the acid for your stomach to normalize, for your stomach to have a normal digestive function. I think it also has some pancreatic enzymes in there as well. So Zypan is a great go-to digestive enzyme product if you want to get your stomach back on track for digesting meats and proteins. So I would take between 1 and 3 of those Zypans per meal, depending on what type of meal I had. So if I had a ribeye steak or something like that, I would take 3. A normal meal would be 1. And so I took this supplementation for about another month, I think, maybe a month and a half. I wasn't taking Pepcid. I was having no real symptoms as long as I took the digestive enzymes. And I was normalizing my diet, getting back to eating the normal foods, and I was feeling pretty good. And then towards the end of that, I started to phase out the digestive enzymes, so I stopped taking as much Zypan, and I would just reduce it down to where I was only taking it with really heavy protein meals, and then I was skipping every other day, and then eventually I just stopped taking it altogether. And I did okay with that. So that was the process that sort of led me to healing my stomach, and the whole thing took many months of going through this 2 steps forward, 1 step back sort of routine to get where I am today, which is pretty much healed now. And as a result of going through all that, I can say that for me, drinking apple cider vinegar, if you have gastritis, is not, it's like the worst thing, and you can really seriously injure yourself if you do that. So you should really, if you're suffering, speak to somebody that has experience. Go to your physician. Medications are not necessarily a bad thing short term, but different people react differently to different medications. For me, I couldn't take omeprazole, and I think long term it's a bad idea. Pepcid worked really well for me. I read on the internet that celery juice was really good for helping your stomach make its own acid. So I decided to give that a try at one point, and they recommend 16 ounces of celery juice a day, but man, that's like 2 big bundles of celery that you have to juice, and that costs $4 a bundle. So I'm doing an $8 drink of celery every day, and it's a hassle. It takes me 20-30 minutes to prepare this, wash it, to juice it in my machine. It's just not practical. And people who say they do this every day for like 2 months or something, or every day for like years, I think they're full of it, right? Because it's just like there's no way you could do that much celery. So I investigated that, and what I came up with was celery seed extract. So MetaHerb makes a product called celery seed, and it's an herbal tonic where they take the seed of the celery, they extract the useful chemicals, and they concentrate it in a 200 milliliter bottle. And you can take 5 milliliter shot of this every day and get the equivalent of 16 ounces, actually more than 16 ounces of juiced celery. You get all of the medicine from the celery. And so after I finished with the Zypan and I was off all the digestive enzymes, I did take some celery seed extract, and I found that is a really soothing, nice sort of segue herb to take to help your stomach sort of recondition, help your stomach kick up its production of acid naturally on its own. Because when you stop taking the digestive enzymes, the Zypan, there's going to be a rebound effect. There's going to be a period of time where your stomach is going to be like, well, now we're not getting any digestive enzymes, and it's not used to working as hard, and there's going to be a period of time where it's going to lack. So the celery seed extract is a really affordable way to get your body the chemicals. It's a really great way to get your body the medicine it needs to help build back up your natural stomach acidity. And that's really and I still take that to this day. I'll take a little bit of celery seed extract a couple of times a week just to keep my stomach healthy. And as a side note, it also works really well if you have gout. It's good for arthritis. It's an anti-inflammatory, so there's a lot of good positive things from celery seed extract that you can look into. One of the things to discuss also is this esophageal sphincter, the lower esophageal sphincter, the LES. And what happens is this is a little valve that's supposed to stay closed to keep the acid in your stomach from going up in your throat. There's a lot of things that can weaken that. Things like diet, smoking, alcohol, these things all weaken that valve. And when it gets weak, it allows the acid from your stomach to go up into your throat. Now, there's a lot of people that say that there's no way to rebuild that. You can't strengthen it with exercise. You have to get surgery if that happens. And in a real bad situation, the valve, everything gets so weak there that the stomach comes up into the esophagus and you get like a hiatal hernia. One of the things that I did to help strengthen my LES was PEMF therapy. And you can watch other videos I made on PEMF therapy, pulse electromagnetic field therapy, where I would take a paddle, put it right here, and I would use, I was using like low pulses per second. I think I used like 2 to 3 pulses a second at really high intensity right in this area and shooting that magnetic field into this area and getting a nice contraction. And I was toning my LES with PEMF therapy. And I was doing this the whole way through the program. And that really helped. I believe that not only was responsible for probably 20 to 30% of my success, but I really believe that you can tone the lower esophageal sphincter with pulse electromagnetic field therapy. And in the couple of weeks that come, I'm going to be doing some testing with that using diagnostic ultrasound to be able to see how PEMF therapy affects that lower esophageal sphincter. And I'm hopeful that I can prove that it does tone it, and that's going to be remarkable for people that are suffering with this. That's going to allow people to probably avoid surgery. So we're looking forward to seeing those results shortly. If you have any questions, please contact me, subscribe to the channel, you can email me, and if you want to know more about this, click the link below and you can follow up on my website on the blog where I wrote all the references that you can go over and see the actual products that we're talking about. Thank you very much.